Hi, I'm Teresa Martin from Lower Cape TV, and welcome to the second season of The Minds of Summer, produced in partnership with the Cape Cod Institute, which brings leading thinkers and doers from around the world to its renowned week-long workshops right here on the Outer Cape. The damage we inflict on one another can be so horrific that it doesn't seem real sometimes. In the context of war, from World War I shell shock to today's traumatic brain injuries and post-traumatic stress disorder, it seems that we hurt not only bodies, but also brains. They reel from concussive forces and hard blows and searing imagery that create ongoing damage in ways and for reasons we may not fully understand. Today's guest has spent 4 decades studying and trying to treat the effects of these atrocities we inflict on one another, both at war and, it turns out, at home. Welcome, Dr. Bessel van der Kolk. Dr. van der Kolk is a professor of psychiatry at Boston University School of Medicine. He has well over 100 peer-reviewed papers on psychological trauma and directs the nonprofit Trauma Center in Boston. His most recent book is the best-selling The Body Keeps the Score: Mind, Brain, and Body in the Healing of Trauma. It's terrific to have you here today.
Hello.
Thank you. Welcome. Your name is often linked with pioneering work in PTSD, and in fact, you start your new book with a moment from the Tuesday after the 4th of July in 1978, with a story about the Vietnam Marine veteran named Tom. And so I sort of wanted to ask, how and when and why did you start studying trauma, and why PTSD?
Oh, you know, questions like this always lead to rationalizations, because we basically are attracted to whatever our brain attracts us to, and then we try to rationalize it afterwards. You know, a good story is that I was born at the end of the Second World War. My father was in a concentration camp. I was one of the birth cohorts in the Netherlands where 100,000 kids died of starvation. I was a very ill child, and then my early memories are of all these relatives who had these strange reactions. But you know, I have 4 siblings and none of them give a damn about what I'm studying. So you know, these are all nice stories to tell, but they don't explain anything.
You just stumbled across it?
What happened to me is that when I started to work at the VA, I got really fascinated by how people get stuck in the past who before were very competent people. Everybody you know is looking forward to the future and what's happening now, and meeting these very competent, smart people and say, they keep replaying the past and cannot come into the present. And that fascinated me. And part of my fascination is that, you know, the word neuroscience didn't exist yet at that time, but I've always been a student of the brain. I did the first neuroimaging studies on PTSD, and I'm into poetry and art and complex psychological theories, and this is the place where I could combine my interest in between science and culture.
Now that's one of the things I think is so fascinating about how people react, whether it's a trauma experience as a child or trauma experienced in a war or a violent situation, is that you can't always see something outward, and yet something is clearly going on, and it's so hard for people to understand that there's something real.
Yeah, you never see what you get. You know, I can come across as a perfectly reasonable human being, but an hour from now I may have a horrendous temper tantrum in the parking lot with somebody who does something innocuous to me. And so that's the nature of being traumatized, is that you have an apparently normal self that can get away with a lot of stuff, and then at the core some emotional issues get very, very hurt and injured and keep coming back.
Well, in the years since you met Tom the Marine, and you talk about him and how he has these nightmares, he sort of doesn't want to give up. And that really throws you. Why do you want to do that?
That opening line just stunned me. So So, you know, I do what young doctors who don't know anything do. I think, oh, I'll give you a drug to make your nightmares go away. And then it turns out, he says, I didn't want to take your drug because I need to be a living memorial to my friends who died in Vietnam. And I thought, oh my God, this is so much more complex. This has to do with love and loyalty and connection. And then he told me his father had the same relationship with his friends who died in the Battle of the Bulge in 1944. And I go like, oh, so it happened to his dad. His dad was a terrible father to him. And then he wants to escape from all that, show how good he is by joining the Marine Corps. And the same damn thing happens to him, that his dead comrades become more important than live people. By the way, when I did my first book reading, to my astonishment, the second person in line to have his book signed was Tom.
No.
And he very proudly said, "Hi, Dr. van der Kolk. Half of what you said was true, half was a complete lie, because I never committed atrocities in Vietnam. It's true, because I contaminated the story of several people.
Right.
And I had always wondered what happened to him. And he looked fantastic."
Wow. So you can reconnect to the present.
People say that PTSD is so hard to treat. That's actually not true.
What do you mean?
Everybody say, oh, PTSD is hard. No, we know how to treat PTSD extremely well, actually.
Why don't
It
we?
happens not to have to percolate in the VA, which is still doing stuff that doesn't work particularly well. But, you know, we know a lot of stuff.
I mean, we hear about it a lot again because of all the, you know, Iran, Iraq, Afghanistan, you know, people coming back with sort of invisible injuries.
Well, not that invisible, actually. When you go to a family gathering, it's not so invisible who is traumatized. You know, people are collapsed, people have temper tantrums, people blow up, people are not playing along. No, it's not that invisible. It really comes out quite clearly in behavior.
Well, in that intervening time, have we learned more? Do we understand why this happens to some people and not others, or is it still kind of,
you know, people make a big deal out of that. The same thing doesn't happen to two people. You know, if an explosion, there's an explosion here that kills our cameraman, we have different reactions, but you have a different relationship to the cameraman than I do. And so the stuff about some people are more vulnerable than others, it is sort of a way of getting away from the reality is that it can happen to all of us. And indeed, if you have been abandoned as a child and you have been abused as a child, you're much more likely to get traumatized by later life events. But the romanticism about resilience is, I take it with a grain of salt, these are feel-good stories to deny how bad it is.
Well, sometimes I think in reading, you know, some of your work and some of the sort of discussions about trauma, it almost seems like it says about as much about society as a whole as about any individual. Like I was particularly struck how, you know, 1917 and 1947, I think, there were these almost waves of this stuff's all made up. And that says something, I think, about how we as a society are reacting almost to something the society has experienced.
See, what's interesting for me is that you're living in the denial world. Oh, it's connected with wars. But 1 out of 4 people has been traumatized in our society. There is millions of children who are being abandoned and hurt and abused right now. There is 30 times as many kids who get traumatized than their soldiers. But all the attention goes to soldiers because they are heroes. Not that we shouldn't pay attention to them, but our society is rife with trauma.
Has it always been?
Yeah. But the difference is we now know it and still deliberately ignore it. See, the knowledge is there today. The knowledge is there. We know how much trauma there is. It's been very well spelled out. We know what to do about it to a large degree. And people put their head in the sand. And this is one of the striking things about trauma, is that nobody really wants to face it. So before the invasion of Iraq, I wrote an editorial and sent it to the New York Times. And I said, you know, it looks like you're going to invade a country that had nothing to do with 9/11. That's a choice you can make. But if you do that, about half of the people who you send off there, if they live, will come back and become homeless or drug addicts and will always be unemployed, because it has happened after every war. There will be a substantial number of people who will commit atrocities who were previously pretty benign people, because it happens in every war. There will be a large number of people who will become drug addicts and alcoholics, because that's the primary outcome of sending people off to war. Most marriages of these people will fail because it will interfere with the capacity for intimacy. But they wrote in the editorial, if you choose to do that knowingly, that's a decision you make. But know what you're doing.
Right.
Of course, the New York Times did not publish my op-ed, and everything I said in this thing happened because it happened after Vietnam, it happened after Korea, it happened after the Second World War, it happened after the First World War. We know that stuff.
So why do we keep doing it?
Because we are a self-destructive species. And we think it's really cool to bomb the hell out of people who don't look like us. Go to the movie theater, what do you see in the movie theaters is alien forces attacking America and some nice white guy with blue eyes holding back these alien creatures with machine guns. People buy that stuff.
And
it's crazy.
Yeah, it is.
And I thought that our work would sort of begin to move the craziness of mankind. And one of the things I realized is that we have not made any difference whatsoever.
None, not an iota.
Except on Angela Merkel.
Well, I'm going to jump to the word trauma for a second, okay? You mentioned the New York Times, and a few years ago there was a profile on some of the work you were doing in the Times Magazine, and in there you talk about how you and your colleagues at the Trauma Center were working to redefine what the word trauma means, because it had gotten, everything seemed to be labeled one kind of trauma, and you were doing a lot of looking at, are there different kinds of trauma that happens at different time, and are different approaches to that different? Where has that gone, and are we seeing changes in how we look at trauma?
There's knowledge and then there is policy. So, we created this diagnosis of PTSD back in 1980 in order to remind the VA that war messes people up and you should treat them.
That seems like a pretty simple statement, policy.
I mean, it was nothing extraordinary. But actually, I've never done anything particularly revolutionary, but suddenly it becomes like, wow. And so the first note I get after DSM comes out from the VA is, it says, it has never been demonstrated that PTSD is relevant to the mission of the Veterans Administration. And so I walk into my boss's office and I say, when the institution you work for is more insane than the patient you're supposed to treat, it's really time to get out of there, otherwise you'll go crazy too. And then PTSD gets codified, and that's the diagnosis, and a lot of money goes into it, and congressional appropriations, and laboratories, and centers, and then we very quickly discover is that there's this other vast group of people, millions of people, who have been abused as kids, who have been abandoned as kids, who live without fathers, whose parents are off to jail, whose parents are drug addicts, that are in our society. The Center for Disease Control does a gigantic study, the ACE study, that shows that this is in fact the biggest public health issue in America, and that child abuse and neglect is at the end more expensive than cancer or heart disease.
Wow.
So we study what happens to kids who get abandoned and neglected, and we see particular brain tracks that are different from adult trauma. We see particular mental effects, biological effects, and so a group of us who really know about this stuff put in a proposal for the American Psychiatric Association to create a new diagnosis that recognizes this, called developmental trauma disorder. And we sent data on 20,000 kids who we have studied, and data from 200,000 kids from studies around the world. And the APA says it has never been demonstrated that childhood trauma has serious effects on mind or brain development. And it's left out. And you go like,
common sense says,
like,
like-
why? Like, what?
yeah.
And so we live in a screwy world. And so right now, these kids who, with these backgrounds, are diagnosed with conduct disorder, oppositional defiant disorder, ADHD, bipolar disorder. But in fact, these kids' brains are living in a dangerous internal world.
What happens to brains when on the developmental side, what happens?
Oh, all kind of brain functions that have to do with focus and attention get disturbed. So when you're constantly on alert for danger, your brain specializes in detecting danger. And so if you have a brain like that, I'll be sitting with you and go like, she seems like a nice lady, but I think she's going to mess with me. And so my detector of danger is hyperactive, and the moment you do anything that might be interpreted as being dangerous, I'll go in a panic reaction, I'll become enraged with you. You don't know what you've done wrong.
Right, you think you're just doing some
You'll
innocuous
think
thing.
this guy's a nut. But from his point of view, you just curled your lip up a little bit, that means that you're going to hurt me. And so your brain changes, or you shut yourself down.
Right.
Or a very, very important part of the brain, anterior cingulate, is part of the brain that filters out what's relevant and what's irrelevant. And when anything goes and you don't know what's relevant anymore, you're continuously distracted by other stuff. That means you cannot study, you cannot focus, you cannot earn a living for yourself. These are very, very serious consequences that up to now are not really in our core definitional system of trauma. It's well known, and so my book is about that. Yeah.
So what do we do?
You just do what you do. You collect data and develop treatments
And you study it, and you study it, and you show it's harmful?
No, I don't just show what is harmful. I'm very much into, if we know how it is harmful, how do we get that piece of information, and what sort of treatment do you institute in order to counteract that particular thing? Let me give you an example. I was an advisor for the Truth Commission in South Africa. At one point, I have the chance to talk with Nelson Mandela at the reception. And I say to Mandela, I understand you were quite a violent man, and the head of the terrorist army before you went to Robben Island, and then you come out and you're this deeply mindful, thoughtful person. What do you attribute it to? And he says, boxing.
Oh.
I go like, boxing? Isn't that a terribly violent sport? He says, no, in boxing, you need to know, really look at what the other person is doing and assess what he's going to do, anticipate his moves, know where your body is and how to anticipate what you're doing back. And I go like, that is brilliant. That's exactly what goes wrong in traumatized people, who are always sort of reacting to the wrong thing, and you get your block knocked off if you don't have that in place. So maybe boxing or martial arts or tango dancing may be an outstanding treatment for this.
And it kind of retrains your brain to look at real cues
really
and move your
focused,
body.
to be attuned, to see what the other person is doing, how you need to be in tune with the person. And that's the sort of thing that goes wrong when you're traumatized. So the study I've always wanted to do is comparing tango dancing with cognitive behavioral treatment. I mean, that's what I do for a living. I compare, I'm a scientist, I see which one is better. I wonder about tango dancing.
Well, see, that's one thing I really like about your stuff is you don't follow always a given line, that you're not afraid to say what if.
You see, in my training was that it was a very selective training program at Harvard, and we were forbidden to read books during our first year. And we were told you have only one teacher, and that's your patients. And most textbooks are filled with nonsense.
Yeah.
And you can't trust what textbooks tell you. As it turns out, most textbooks are filled with nonsense, and so you see what your patients need. And then you write the textbook, which may also be filled with nonsense. It's for somebody else to judge. But the reality at the end is what is going on with this human being, and how can I help this human being to have a full and rich life.
Well, isn't that what science is supposed to be? It's about observing what's in front of you, listening and seeing and trying to make sense of it, not trying to take another notion and put it on top of something.
But what's surprising to me in our field is how religious people become. They find one form of treatment, which may be quite helpful for some people, and say, I have found the fountain of youth. I said, no, you have found something that makes people 10% better in 80% of the cases. That doesn't mean I found a treatment of choice. I found something that is most of the time can help a little bit.
Right. Like you were saying before, no one experiences an event in the same way. So what happens to the brain is not going to be identical by definition.
Nobody benefits from the same thing.
Yeah.
And so you need to do many different things and that's what clinical work is about, is that, so what can help this particular person to shift in a state of focus and safety? For some people it's drugs, for other people it's yoga, for other people it's EMDR, and we don't know for sure.
Well, I think in American society it likes answers that wrap up easily. That would be particularly difficult. And that's why treating with drugs is very attractive, because it seems like it's a replicable thing.
Well, see, I'm a scientist. I believe in replicable results. I mean, I study and I look at statistics and see what works and what doesn't work. But people don't like complex answers. I keep being impressed, like, oh, this is a great treatment, and it looked, let me tell you that story, how great it was. And you go like, okay, and how about the next person?
Yeah, that's right. Oops.
And what else? And what happened 5 years later?
Right.
And I think people have a hard time dealing with complexity. What people don't have trouble with dealing with complexity is in cancer patients.
Why is that?
Because everybody deals with cancer patients. It's a question of life and death, and you cannot blame people for their cancer. But when it goes to kids who cannot learn in school and kids who are a pain in the ass, people want simple little answers.
And they want them now.
They want them now, and you want this kid to shut up and behave.
Yeah. People aren't it's not comfortable for a lot of people to be around someone who isn't acting the way they expect them to act.
On the other hand, a real school teacher, of course, loves those challenges and loves the complexity of a classroom. And a real clinician loves the complexity of a practice and to see that one size doesn't fit all.
So, to change the treatment of trauma, do we have to change the way clinical practice works as well?
I think there's a tradition that is gone, by and large. And that is when I trained, we need to try everything on ourselves. I was a very early psychopharmacologist. I did the first controlled studies on Prozac and Zoloft, and we took these things ourselves.
You did?
Yeah. And you see, how does it work on me? Oh, I wonder how it works similarly on other people. And so I went through psychoanalysis, and I had all these various treatments that I recommend to people.
Right.
So you get a sense of, okay, this is what it changes in me, and so now I can see, okay, this is how it was helpful for me. This person is different from me and has much more trauma than I have, but this might just do it for people. But at the end, you are an important intermediary person who has a sense of how this can shift your internal balance.
What's that balance? It's all about balance, right? In your book, you intentionally use the word body and mind together, and it's almost like it's a tango between the body and mind sometimes.
Well, we no longer do body-mind dimorphism, actually. That is over.
Are you sure about that?
Well, other people do it, but we try not to do it. Body, mind, and brain are sort of all woven together, and just smoke some dope and you know how everything changes, or get drunk and everything changes, or break your foot and go in crutches and you know how everything changes. So everything affects everything else.
Right.
That's how things are. And so, but what is very important is that what we really learned about trauma is that trauma is re-experienced in the form of heartbreak and gut-wrenching sensations. And the trauma, it doesn't come out as a story, It comes out of feeling crazy and weird. And that's interesting that later on I discovered that Charles Darwin had written about it in his book, The Emotional Expression of Animal Men, in 1872. He says, brain and body are closely connected with each other, and what comes very clear out of all the neuroscience studies and Antonio Damasio's studies and our work and the body work is that trauma changes your relationship to your body. Your body is on constant alert, your body is frozen, you cannot feel your body anymore, your body is not a live organ. And so when you look at a very large study, like the ACE study, where they look at the consequences of trauma in over 17,000 people, the symptoms have to do with taking care of your own body. Being able to regulate your body, being able to calm yourself down, being able to limit your food intake, being able to protect your body by not having unsafe sex, by not smoking, by not blowing up with food. And it has all to do with how you live inside of your body. And so the body has become a very central issue for most people who really understand trauma.
So trauma changes your own relationship with your body.
Yeah.
So you're out there looking for threats, or maybe trying to make sense of the world around you because your mind's responding to this trauma, and at the same time, it doesn't free your body to do the things it needs to do to take care of itself?
That's that, but there's another thing, and that is your body feels so messed up that it's scary to feel yourself. And so you would rather think about those awful things out there and talk about those awful things out there than have the courage to go inside and meet all the demons that are living inside of you. And that's a very important part of trauma treatment, is that you need to feel those feelings that are inside of you.
Do you think everyone has experienced trauma?
No. People have experienced bad experiences. No. We have not all been molested, raped, or beaten up by our caregivers. No. Most of us have not seen our best friends being blown away in front of us. No.
So where's
but many people have.
Yeah. And where's that line between, like you're saying, no two people experience the same thing the same. So where does it, for one person, become trauma and the other become a really horrible experience I have to deal with?
Well, trauma is overwhelmed. And so your brain and your mind gets overwhelmed by certain experiences. And what that might be has a lot to do with the system that catches you. So as long as you have parents, spouses, loved ones who say, oh my God, let me hold you, let me take care of you, people by and large do okay. So the very first study I did with Vietnam veterans was that what we found is that the trauma was a sequence of events. These guys were very good at what they were doing, and they were very well trained, and they loved what they were doing. And then one of their friends got killed, and they went into a rage. Because when your best friend gets blown up by some other guy, you cannot help but becoming enraged. And then they started to do things that were horrifying. They started to kill people randomly. And that combination of seeing this horrendous thing of seeing your friend blown up and then doing things after which you cannot innocently go home, that was for them the biggest trauma. And to some degree that's true also for kids who get traumatized, is that it's not what happens, but how it is received. So if your mom or your dad or your teacher immediately comes up and say, oh, that's so horrible, let me take care of you, you don't blame yourself. But if there's nobody there for you, you start thinking, it is my fault. This happened to me because I'm a bad person, or because I was not alert, or because I deserved it. And so that context in which it occurs is tremendously important.
Well, I hate to say this because I'm really enjoying this conversation, but we are out of time.
Already?
Already, I can't believe it. Okay. But this has been a really terrific, I mean, I've learned an enormous amount, and I thank you very much for being here.
Thank you. Thank you.
And thank you. This is Teresa Martin from Lower Cape TV with The Minds of Summer.